In a world filled with uncertainty, how did we transform the way we think about medicine? For centuries, healers depended on plants and rituals, but everything changed in the 1300s. Humanity faced devastating pandemics that led to entire cities collapsing. The Black Death, wiping out a third of Europe's population, forced people to reevaluate old beliefs about disease. What if illness wasn't caused by curses or spirits? What if it followed rules that chemistry could help us understand? Welcome to Scientific Careers. In this second episode of our series, we explore the evolution of the pharmaceutical and biotechnology industry. If you're a student or just passionate about science, you're in the right place. Let's embark on this fascinating journey together. Before the plagues, alchemists fiddled with the early forms of lab techniques like distillation and crystallization. They didn't fully grasp their work, but they were paving the way for future science. Then, disaster struck. The Black Death swept across continents, leaving fear and devastation in its wake. Cities burned incense, while doctors donned strange masks filled with herbs. People believed the air was poisoned, but questions began to arise. If disease came from imbalanced humors, why were whole families falling ill at once? This crisis shattered old medical theories, nurturing the seeds of scientific thinking. In the 1500s, Paracelsus, a bold Swiss physician, challenged the status quo. He argued that medicine should be rooted in chemistry, not superstitions. Daringly, he burned ancient medical texts and experimented with minerals as treatments. His message was clear: diseases had specific causes, and chemicals could target them. He introduced the groundbreaking idea: the dose makes the poison. This marked the birth of toxicology and pharmaceutical chemistry. But calamity didn't stop. The Great Plague of 1665 devastated London, with doctors meticulously recording observations. They began to suspect disease spread through particles, not curses. Smallpox epidemics prompted early vaccination experiments, forcing physicians to think like scientists. By the 1600s and 1700s, the mystical language of alchemy faded, giving way to scientific breakthroughs. Robert Boyle revealed substances were made of particles, while Lavoisier discovered oxygen. The early periods of chemistry began to take shape. This led to the first reproducible medicines like ether and salicylic acid, the ancestor of aspirin. For the first time, healers could isolate active ingredients, molecules that worked. This era marked the dawn of pharmacology and pharmaceutical manufacturing. Every leap in medical science stemmed from crisis, urging humanity to question, measure, and experiment. Plagues drove us to abandon superstition and seek truth through science. Without these struggles, vaccines, antibiotics, and modern breakthroughs might never have happened. Humanity learned through suffering, and here's the lesson for aspiring healthcare professionals. Progress thrives when we remain curious, challenge outdated ideas, and embrace innovation. The scientists of this era lacked modern tools but possessed courage to explore and question. This mindset fuels today's pharmaceutical breakthroughs and will shape the next generation of innovators, including you. Want to continue your journey into the incredible world of medicine? Like this video, leave a comment, and subscribe. Your adventure in science and healthcare is just beginning, and we're here to guide you every step of the way.